So what are the myths and misconceptions that you encounter when women come to see you, particularly about women's cancers? What are some of the things that Dr. Google and even our own chamas and gossip spaces that we tell women when they come to you?
Thank you very much. I'm grateful to be here. One of the myths that we hear or we get to hear is that I'm too young for cancer. I don't need screening, and that cannot be further from the truth. Basically, because the issue with the women, cancers that affect women, is that most of them will be discovered later in the stages. For example, ovarian cancer, 70% of them will be discovered in stage 3C. Of course, when you hear the stages, we have heard about the stages out there. So basically, by the time you're stage 3, it's to mean you're further along the line. Yeah? So the other thing is that, the other myth is that we hear there is hope in not knowing. When I ask my patients, okay, why have you not had a pap smear? They tell me, Daktari, you know what? There is hope in not knowing. I don't want to know now, and I weep, when I hear that, because again, most of the cancers in women can be treatable, and curable, okay? But if found earlier in the stages, okay? And that is why we are encouraging our women or our mothers and our ladies, let us all get screened, especially for pap smears or what I would say cervical cancer screening, which should be done between the age of 21 to 65. Remember I said we are never too young for cancer, right? But we can be screened and can be found in good time. Remember, cancer of the cervix will develop over a long period of time, okay? From exposure to HPV, the virus that causes cancer of the cervix, to full-blown disease, it will take 10 to 20 years. But what can we do between 10 to 20 years? In between that period is to screen. And why do we screen? When we screen, then we get to know if there are changes in the cervix that, if left unattended, will become cancer later on in life, then we can arrest it, okay? So there is no hope in not knowing. There is hope in knowing, because when you know, we can treat, okay? When you catch it early, it is curable. But when you wait until you get the symptoms, painful vaginal bleeding, pain during sex, bleeding after sex, or foul vaginal discharge, by that time, you're far gone along the line, okay? Yeah, so I think those are among the myths that we hear most.
That ignorance is bliss. That's what if I don't know, then I'm okay, right? So we will get to know and get to do the screenings when there's need be. Doctor, before I go to Elizabeth, the issue of HPV, and I've had parents ask me, especially when the government was rolling it out, should I let my teenage girl be vaccinated against HPV through the HPV vaccine?
Yes, absolutely. I would encourage that we have our daughters and, if resources allow, sons to be vaccinated. Why? Because the HPV is the vaccine that causes cancer of the cervix. At least 99.7% are attributed to HPV virus. Yeah. Okay. So if you vaccinate, we can stay away from it.
Okay. Now let me go to Elizabeth. Breast, ovarian, and cervical cancer, we applaud you for being a warrior and, for also being willing to come and tell us your story. What barriers, challenges did you face, getting diagnosed and getting care for these 3 different cancers?
Okay. Hi, everyone. My name is Elizabeth Future Kiuma, a 4th-year student at KCA University pursuing Bachelor in Journalism and Digital Media. Back to your question. Okay, some of the challenges that I faced. Okay, the biggest challenge was denial. I was in denial. It was so hard for me to accept that I had cancer. But, okay, financial, the society that was around me as well. The challenges were too many, but the ones that really affected me was denial, financial, and the society.
How
Yeah.
did you get to know that you have cancer?
Okay, back in 2012, I started bleeding while I was in class. My breast was bleeding. I was fat. Let me call it fat. So I started bleeding, and when I went home, I was taken to a local facility. Then I was given some medicine that I used, like a robe. Then I didn't know right from there. When I was back after some years, now in 2017, when I was already in high school, the same thing happened again, and I had lost a lot of weight. Then I was in Mwani Girls. The deputy said that I was supposed to be taken to Water Level 5 Hospital, and that's when they told me that I was supposed to go to Kenyatta. I went there with my grandmother, and she's the one who was given the results. Yeah.
Sorry for that. So what did your grandmother tell you? How did she tell you this information?
Okay. My grandma just told me, kunywa dawa ama utakufa. Yeah, that's what she said.
Okay, I'm happy that we can laugh about it now that she's well. But I think those are some of the things, when we don't have the right information. And Joanne, you'll be able to address that. How do we empathetically and compassionately, deliver these stories? So we'll come back to you, Elizabeth. Let me come to Dr. Gidinji about diagnosing cancer. Sometimes, and the experiences that women have, you suspect, but you're not sure. What is your role in confirming or telling the women that, this is cancer or this is not cancer?
Yeah. I want to make a correction. I'm not Gedeji, I'm Derito. I think that was a typing error. So I'm Dr. Derito. I'm a clinical and radiation oncologist. In the cancer journey, we have a lot of what we call, it is a multidisciplinary kind of management approach, where there are those who make the diagnosis, there are those who do the treating, there are those who do the counseling and all that. So in terms of a patient who comes, or somebody who is suspecting I could be having cancer, or I'm having a concern, I am having bleeding, I'm having pain, maybe we are talking of the cervical cancer. We know the two most common cancers for women is cervical cancer and breast cancer. Breast cancer being the most common, followed by cervical cancer. But if you look at the number of deaths, you'll find the deaths are mainly there are more deaths from cervical cancer than breast cancer. And that is a major concern, because overall, even among the men and women, the women cancers are the most common. And if you're having almost 15,000 cases of cervical and breast cancer combined, and more than almost half of them die every year, that is a very concerning number. And that is something that we all need to act to help curb that menace. But in terms of our role in management of these patients, is that you have come with a suspicion. Maybe you're having a lump in your breast, or you have the bleeding like she talked about, or you have pain. The first thing is you go to the nearest health facility that you find. Once you go there, you may not find an oncologist, you may not find a gynecologist, but with more education and more awareness, the healthcare providers are able to navigate you to where you can get help. And then here now we help you go through the process of making a diagnosis. You are examined, you have a biopsy taken. A biopsy is some tissue that is taken. It is taken to the laboratory. The pathologist comes in there to help make a diagnosis. Once we make a diagnosis, we have the other experts, the radiologists, who will do the the scans and all those other investigations that will help us know how far is this cancer, if it is cancer and it is confirmed. Once that is done, through this process, you also take you through the counseling so that you come to terms with what is happening, so that you are also part of the journey and you are able to be navigated through the treatment.
Okay. Thanks for taking us through that. Dr. Mutahi, on your role as a gynecologist, what is it in making sure there is early detection and prevention, even when you're in your individual clinic or even if it's a big facility? What is your role? Because you said, if it's caught early, then it's manageable, it's treatable. If it's late, then things are really difficult, both physically, emotionally, and financially.
I think one of the conversations we've been having as gynecologists is we are encouraging each other, take 2 minutes and look at that woman's cervix. That is a conversation that is going on with us gynecologists, because one of the things that we found from the level 1, 2, and 3, by the time the patient gets to a gynecologist, this patient has been treated for daktari niko na kakitu kamefura, and then the doctor says shika krimu kapake, and then she will show up 7 years later with a huge cancer of the vulva. Okay, so one of the issues is that the doctors are becoming more and more proactive with examining their patients, being up to date with the current trends of treatment, being more and more current with the modalities of screening. Okay, and the other thing we've done, for example, in my clinic, I always, for my patients who are coming for postnatal clinic at 6 weeks, that is a perfect time for me to do a pap smear, because after that they have given birth, and probably I'll see them again in their next pregnancy, and I don't want to miss that chance to just screen. So, and also for the patients, be your own advocate. When you go to a doctor and you have something that is growing, ask the doctor, unaweza angalia? And it will go a long way. Even if you find that doctor is not keen on examining, be your own advocate. Ask your doctor, I have this and that and that. What do you think? Go for your medical checkups, okay? We are open. We are going to be there for you, okay? Thank you.
Thanks, Dr. Elizabeth, through your journey with various healthcare providers and professionals, how do you think they can better support women and somebody like you emotionally, especially when you're at that stage when you're in denial and you also don't know what's happening? How can they better support you through that journey and process?
Okay. One very important thing I know, healthcare providers play the biggest role during this time. And from my own experience, I would say that what I would request them to do is telling the patient the truth. Tell them what they should expect. Don't lie to them. Don't tell them those sweet words. Like, I know they care about us, but I would prefer if she tells me, if you don't do this, the same thing my grandma told me, if you don't do this, you're going to, than telling me, oh, you see, you go to the hospital. Like, I used to go to the hospital, my breast is bleeding, and the doctor tells me, just use a cotton, you'll be okay, wait for the next patient, you see. But I would really prefer if she told me, this is worsening, like, you get. Yeah. So I really pray and request the healthcare providers to just tell us the truth. It is better the painful truth than the sweet lies, because by the end of the day, you're going to know the truth, and it will come out soon.
Yeah. What did you do to move from a point of denial to acceptance so that you can successfully go through your treatment?
Okay, this is what happened. There is this number that I had, and it used to send me a lot of Bible verses. So I decided to call that number, and his name is Hussein. He works with BF Suma. So I called him and told him, by then I thought he was a pastor. So I called him and told him, okay, I have cancer and I don't know what to do. So he gave me a number for Aline Jerry Mwingwi. I know you know her, the founder of Uskimia Foundation. So she came to school that day, still in KCM. She came to school, picked me up, and took me to Faraja Cancer Support. So after the counseling, I accepted that, yeah, I was sick. And that was the start of my healing journey. Yeah.
Okay, thanks for that. Dr. Ndiritu, thank you for that. How can we bridge the gap between diagnosis and treatment, or timely initiation of treatment, so that we can save as many mothers, as many women as possible?
One thing you'll notice is that a lot of patients who come to the hospital, we say they have come to the hospital late with their cancers. Most of them will have seen one healthcare provider or another at maybe at a lower level of hospital. And what we usually do is that we encourage and we do a lot of capacity building so that even at the lower levels of the hospitals, they can be able to suspect and navigate a patient through to where they can get care. In terms of helping these ladies to get to the proper care early enough, first of all, is to have advocacy, a lot of advocacy, this being one of them, to help them know that even if you get this diagnosis, if it is captured early, it can be treated and cured. And there are many testimonies of those cases which have been diagnosed early and cured. So the first thing is from yourself. Know yourself. We usually say, like, if it is your breast, know your breast very well. Be aware of your breast so that anytime you notice something different, you should be able to seek help. If it is the other cancers, know what are those signs that are not normal. It is better to go to hospital and be told this is normal than staying with something that you're not sure what it is. So the other thing is, be afraid of the healthcare providers, be afraid of the doctors so that they are able to navigate you early enough. The other thing is, from the healthcare providers, is for them to be well aware that cancer is here with us. Cancer is the third leading cause of death after infectious diseases and cardiovascular diseases. So it is a major cause of health issues in Kenya. And we should be very well aware, even at the lowest levels of hospitals where patients will be able to go. So from the healthcare, it is to make them aware that the cancers are here and they are this common so that they have a high index of suspicion. From the person themselves is to look at anything that is not abnormal, that is not normal. Go and seek help and be advised whether is it normal or not normal. Then after that, is to adhere to the advice given. If you're told you need to go for biopsies, go for biopsies. The other thing is access to this care that we are talking about. It is not cheap. So from the government side is to increase the resources so that ladies are able to access the diagnosis. The diagnosis is a part that had never been covered very well, so that they are able to get access to the specialized tests that they need, and also the treatment. But somebody talked about, I think she talked about SHA. SHA actually, as much as we want to say that, I know people say it is not working, but I can tell you it works. So if you don't have SHA, please get enrolled in SHA. And it is getting to pay most of those costs. Of course, there are those problems that may be there initially, but all in all, I know my patients have been benefiting from SHA. I'm not talking on behalf of government, but I work for government too. But I'm saying because I know it works. I work in Kenyatta National Hospital, so I know SHA pays for patients. So it is good to have those health insurances that may help. There are other private health insurances also that help cover these things. If it is your parents, get them enrolled in these insurances. You may need them at some stage.
Okay. Before I let you go, Doctor, you've talked about people to seek care is this care available within the borders of Kenya? Because we get many people get diagnoses and they're on the first plane out to India. Are these forms of treatment and care available within the Kenyan borders? And if so, are they as advanced as you would want to when people are seeking care outside?
Over the last couple of years, let's say about 10 or 15 years, the advances in healthcare in Kenya, it has advanced so much. You have a lot of diagnosis being done right here in Kenya in terms of the scans that we do. There are scans that people used to go to India, let's say like what we used to call the PET scans. Now they are available. There are several centers in Kenya, not even one, which is doing those specialized tests. In terms of training, we have very high quality trained medical personnel, ranging all the way from those who do their diagnosis and those who do treatment. I can testify that most of the specialists we have, even in the field of cancer, they are trained at the highest level that we can talk about, talking about the oncologists, the gynecologists, the surgeons. So we have all the experts that we may need for diagnosis and treatment of these diseases. In terms of facilities, in the region, Kenya is quite ahead of most of the countries that we have in the region. And you find most of the treatments that need to be done, most of them are available in Kenya. Maybe very few that you may need to go for outside. But a lot of those cases that you see going outside, most of them is not having adequate information on where to access this. The other thing is perception. Over a long time, people had that perception that you can't be treated well in Kenya. But the experts are there, the facilities are there. The other thing is that there are those, let's say, medicines, the cancer medicines that may not be available in Kenya. Instead of going outside, the drug can get here faster than you going for it there. So, and the experts who administer this, they are available in Kenya. So to answer your question is that these services are available. The experts are there, but in case you need to go out there, discuss with your primary doctor or your oncologist or your surgeon or your gynecologist. They'll advise you, this is available here and here. Whatever is not available, the doctor has no reason not to send you to where it is, where you can access it.
All right, thanks, Dr. for that information. And for Dr. Mutahi, how can then the private gynae clinics or the clinics in the hospital run by gynecologists, how can they be integrated into other programs? Because if we have PET scan, we can only have so much. If we have, radiotherapy treatment, it can only be so much. So how can that system be well integrated to be seamless, to be able to treat women? And I say this because if I come and see you and I get the diagnosis, I'm probably going to be told to go across town to see somebody else for something else. How can that experience be seamless? One, so as not to waste time for treatment, initiation, and management, and also just for the comfort of a woman coming, knowing that within one fold or one place, I'm able to be taken care of from prevention all the way to treatment if need be.
I think one of the ways to get women or patients treated better and faster is definitely one by advocacy work. Something like this, then I will get to know Dr. Deritu, and then after that I'll get to know somebody else as a health worker, a health service provider, and from that I can be able to refer my patients or as need be. The other thing is, if we were to get these services available in our government hospitals, probably taken care of by SHA, you'll find most of the specialists are available in these government hospitals. But somehow, as the patients, we also have a notion that sitaonekana na daktari mkubwa. That statement that we tell each other out there, it is not true. I think we also need to change our perception of the healthcare system.
Okay, thanks. And Elizabeth, To the women who have come here, they're listening to you. What advice would you give them about listening to their own bodies and being advocates for their own health?
Okay. What I can tell them is, first, don't be scared. Don't be scared to do the screening. Don't just ignore your symptoms. I know our bodies react differently, but that very first warning should be a wake-up call to every one of us. And have in mind, even when the results turn out the way you don't expect them, raise up your head and look forward. Think about you. Don't take any negative comment, even when they tell you that is the end of you. Please just remember that you matter and no one else matters more than you do. So that is all what I can tell you. Yeah.
Thank you very much. Let's give a round of applause. Dr. Mutahi, what advice do you give to the women listening to you today?
I think for me, one of the messages I would want out there is get screened. Get screened, get screened. I cannot say that enough. Get screened, okay? Because there is help after screening, okay? Most of the cancers are treatable, caught early, and curable, not just treatable, treatable and curable, okay? So get tested, get screened. Very important.
Thank you very much, Dr. Mutahi. Let's give a round of applause. Then, last but not least, Dr. Nderitu, what advice do you give the women listening to you?
If we look at the most common cancers, they are cancers of women, that is breast. And if you look at the top 5, you have the breast, you have the cervix, you have the ovarian cancer. There are also those others which are shared between men and women: colorectal cancer, cancer of the esophagus. And then somewhere there you have the prostate cancer, which is mainly in men. If you look at the 2 most common ones, they are preventable, they are screenable. You can be screened early enough. If it is breast, it is very easy to screen. There is what you call breast self-examination, which you should get trained on how to do it, so that you're able to examine yourself every day, or every time when you're taking a shower or something like that. If it is the cervical cancer, the symptoms are very clear. You'll be able to notice them very fast. So what we are saying is that be aware of your body, be a friend of the healthcare provider, so that you get help in case of any problem. Remember, what was said earlier, that what you don't know does not harm you. It is not true. If it is a cancer, if it is there, it is there. Let it be diagnosed early and treated. If you go there and it is not found, then you're in a safe place. But be aware of your body, seek for help if you need to.
Okay, thank you very much. Ladies and gentlemen, let's give them a warm round of applause. Thank you for telling us about cancer. The message is get screened, get to know early. Ignorance is not bliss.